Welcome, everybody. Thank you so much for taking time to attend this webinar on navigating health data privacy and ethical challenges. We're here on October 31st, the last day of October, and October is officially recognized as Cybersecurity Month. So we're really honored to bring a great and distinguished panel. Before we get started, two housekeeping rules. So number one, we want this to be a really interactive session. So you can, as our speakers are speaking, you can submit questions in the chat box. And we will be queuing questions and then distributing them to the various speakers so that we can hopefully get your questions answered. And then the second housekeeping item is that a day or two after this webinar, we'll be sending everybody the actual recording for the webinar so you can go back and look at it, as well as a lot of resources. So some of the speakers on this call belong to organizations that are actively publishing resources for all of us to use as it relates to data security and privacy. Good. So, as a way of introduction, I think those of you who've attended other Broadreach webinars know that, my particular passion is all about answering the question, how do we improve access to healthcare and how do we improve the quality of healthcare to everyone who needs it? And I think, the reality is that we do live in a world where there's a lot more people who need healthcare services than we have resources to provide. So resources in terms of workforce, in terms of supplies, in terms of infrastructure, in terms of budgets. And that's a big challenge, but we're in this really interesting time known as the Fourth Industrial Revolution, coined by Klaus Schwab at the World Economic Forum. And there are rapid advances happening all across the board in technology, in genomics, et cetera, that if properly applied, will completely change our ability to help more people. And in particular, there's been a lot of buzz around artificial intelligence and around generative AI, and the potential for that to really help all the healthcare workers do more, be more effective, be more efficient with the limited resources that we have. But what we often forget when we move past all the hype of all this great thing about what could happen with generative AI and AI is that all of that relies on data, and it relies on good data and data that needs to be secure. So there's a foundation that's really important. We need to be able to secure personal healthcare data in a very safe way, and we need to keep that free from attackers, cyber attackers. And often in the news every day, there's always some report of a breach, of a hacker who's gotten people's credit card details, of advanced phishing attacks on big corporations. This is a real issue. And if we're ever going to use these technologies to really advance healthcare, we have to lay that foundation. And so I'm really excited that we've got three phenomenal panelists, all representing different viewpoints around this issue. We've got a panelist that represents implementing partners, so those organizations that are typically donor funded, that work in collaboration and partnership with government and local nonprofits on the ground and community-based organizations to actually enact healthcare programs. And so we'll hear from that perspective what those challenges are from somebody implementing programs. We have somebody from academia who is an expert in the ethics, the regulatory and legal frameworks around data and data privacy and security. And we have an expert from the funder side, from the Global Fund, who can give us a perspective of a donor who's looking across all these issues across many different countries, across many different organizations. So without further ado, I do want to introduce our three speakers. So the first is Rohan Viljan, our Chief Technology Officer at the Broadreach Group. He will really represent the viewpoint of an implementing partner. So Rohan jointly steers Broadreach's specialized technology-enabled management solutions to ensure that the technology that is developed meets the needs of our clients. He is responsible for the execution and success of Broadreach's technology strategy, product roadmap and business plan, product engineering, product operations to support the company's aggressive growth and expansion plans. Rohan has over 20 years of experience in all aspects of software development and support lifecycle. Our second speaker, who's representing academia and brings us a really deep expertise around the ethics, the regulatory and legal issues around data, is Vedanta Singh, who is a research manager at the University of Cape Town's Graduate School of Business. So Vedanta is trained as a multidisciplinary scientist and researcher. She has over 10 years of experience working in healthcare, technology, and organizational management. In 2020, she published the first South African policy guidelines for the ethical use of AI in healthcare as part of the Policy Action Network. Her current work and focus of her PhD centers around ethical organizational decision-making using AI. Specifically, her work investigates the equitable and ethical use of technology to enhance Africa's response to the growing healthcare burden. And finally, representing the donors, we have Stephen Ramsden, Chief Security and Information Officer at the Global Fund. Steve is the Chief Information Security Officer and Digital Architecture Innovation Lead at the Global Fund, responsible for defining and building cybersecurity strategy, cyber resilience, operational security decision support, digital transformation blueprints, and roadmaps. Steve is passionate about the possibilities of digital technology and private and public partnerships for social impact and leaving no one behind. Private and public partnerships to advance healthcare, education, climate change, net zero, sustainability for a healthier planet. Steve has a degree in pure and applied physics and mathematics, and he also, in his spare time, supports university education programs for entrepreneurships, advancing the SDGs with the University of Geneva, Tsinghua University in Beijing, Southeast Asian universities in Singapore and Bangkok, and also focuses on topics such as accelerating open innovation, cybersecurity, frontier innovation technologies, Web3, blockchain, AI, privacy, preserving technologies, advanced encryption, and multi-party computation and quantum computing. Previously, Steve was a former government cybersecurity information assurance advisor for the protection of national critical infrastructures against emerging digital threats. Good. So having said that, and I think along this theme of having an interactive webinar, we're going to actually kick off with an interactive quiz or a sort of a survey. So you'll see probably popping up on your screen now an initial question, and we'll give you 25 seconds to pick your answer, and we'll actually see the results in real time. And it'll be a great way to kick off this discussion. Great. And while you're filling out this poll, hopefully you can start seeing the answers and the percentages of how people are answering. I don't know our team supporting the webinar. Okay, there you go. So on the poll, we can see that first place in terms of the biggest challenge people feel that are preventing them from focusing on data security in their programs or the country is the cost of the technology. So that's 29%. 26% cite the fact that most records are manual is a big barrier. 13% cite low priority, 10% cross-border health data security issues, 16% around employee training and awareness, and 6% on they don't know where to start. So that's a really interesting response. And I think it's a great segue, Ruan, to you, especially putting on your hat as somebody from an implementing partner. Would love for you to kick off with some of your initial thoughts on, why is health data security an issue that needs to be addressed so urgently? Ruan?
Thanks so much for the introduction, John, and welcome to everyone joining us today on the webinar. Really exciting topic, and the fact that we're doing this on the last day of October, I think signals our intention that this should be an all-round discussion year-round and not just in the month of October. It's such a fundamental, important topic that we need to cover. So on the question of why health data security is an issue that we need to address urgently, a couple of things stand out for me. I think first and foremost is the fact that privacy is a fundamental human right. And alongside that, we have health data, which is the most private and the most sensitive data that we have. And we also know that data is critical in delivering better healthcare. And I can speak to this point personally. Last year, my father-in-law went through a fairly severe heart attack, and we had to rush him into ER. And he was being treated in the hospital where he had previous procedures, and his health data was locked up in a different practitioner's room, and they had no access to that data. in order to make decisions on his life. Now, fortunately, he came through that exercise, but as I reflected on that, it just reminded me again how access to the right data at the right time can actually save lives in a real practical way. And so when we think about these two conundrums, we want to use data for better healthcare, but also data as private, and we want to keep that privacy as a fundamental human right. How do we balance the two? And at Broadridge, we believe that we can have the best of both worlds. We do not need to trade privacy for healthcare. And hopefully, as we go through the webinar today, we will share some thoughts on how we can do so securely and in a way that preserves both privacy and gives access to good health. Now, in the lead up to this webinar, we asked our LinkedIn following a couple of questions to get a sense of what people are thinking about and how they are perceiving the threat that is out there. Now, the first question was around which industry is most impacted by data breaches. And we gave the options: government, healthcare, finance, and retail. The audience overwhelmingly said that finance, 37%, was most targeted, government, 32%, and then healthcare in third place, 26%. Now, the bad news for all of us on this call that are in the healthcare field is that that order is actually reversed in practice. So what we saw in 2022 is that only 9% of the attacks were targeted at government, 14% at finance, and then a massive 35% was targeted at healthcare. So we are working in the industry that is most targeted by bad actors in terms of getting access to sensitive data and trying to compromise our systems. So that's the one data point which is not good news. The second is the cost of a data breach when it actually happens. Again, we asked our LinkedIn following, what do they think the cost of a data breach is? And overwhelmingly, people voted for $4.5 million as the average cost, and that is correct. A significant amount of money that is spent on recovering from a data breach, and that includes everything from the remediation, including buying insurance for the affected individuals who has had their data leaked in practice. So back to your question, John, why is this such an important topic? I can stop at it's a fundamental human right. It's the right thing to do. Therefore, we will do it. And then we also have this reality, which is it's a highly lucrative industry. A lot of money is being made by the underworld, and healthcare, the sector that we work in mostly, is most targeted by far compared to all the other industries. So I'm going to leave it there for now, but rest assured, we're not going to only bring bad news today. We will get to some solutions. And I was excited to see the poll that came up. I've already got some ideas that we can share in terms of how to attack this problem.
Thanks so much, Ron. I'd like now, Vedanta, to provide some of your opening thoughts and comments in response to this particular question. With the rapid rise of technologies such as generative AI, what are some of the challenges that health organizations face, and how can we build in guardrails to protect data? And if you could also give practical examples to our viewers.
Thank you, John, for that question. And asking an academic for practical responses is a challenge, but I think I'm going to do my best today. So the overall goal should be to always reduce risks to a level acceptable to the organization while still maintaining the core benefits of the data or the AI system that we are employing. So it is this balance between making sure the benefits of the technology are still maintained, at the same time ensuring that privacy, that patient rights are also protected. And so generative AI models, like the very famous ChatGPT, have emerged as really powerful tools with the potential to really reshape healthcare and healthcare provision. So by processing these large amounts of data, these tools have become very powerful in aiding clinical decision-making. However, the black box nature of some of these models, including ChatGPT, raises questions about how we interpret these decisions generated by these models. And this has, across the literature, both academic and practical, as well as the policy literature, all of this has called for a greater understanding of these AI systems, specifically when they are used in healthcare. And moreover, there's ethical considerations around data privacy, patient confidentiality, and potential biases which these AI models inevitably introduce. And these require careful attention according to these various literature bodies that I've looked at. And because models like ChatGPT will eventually interact with sensitive medical information, patient privacy and data security are really paramount to maintaining public trust, buy-in, as well as practitioners, so a medical practitioner trust of the AI systems. And according to a study in 2021 conducted in the healthcare sector in South Africa by two lecturers, I think, at the University of Pretoria, we found that South African healthcare organizations are a particularly vulnerable target for cyber attacks. And that's for two primary reasons. The first one is there's a lack of regulatory frameworks governing personal health information, and that has changed, luckily, since 2021. And the other reason is there is an inherent poor cybersecurity posture within these organizations. And some of the barriers that the study found to ensuring cybersecurity include inadequate executive management support, isolation between the cybersecurity and software development teams, inability to attract and retain skilled cybersecurity staff, absence of cybersecurity frameworks, existence of legacy systems, inadequate user education, and inadequate disaster recovery and backup plans. Okay, so what can your organization do in light of all of this? And basically, the organization's first line of defense against attacks should be good governance. Not only is this essential for securing reputational risks and demonstrating due diligence to both clients and regulatory authorities, but ultimately data security is becoming necessary to protect patients' rights to privacy. Strengthened through the POPI Act, privacy, specifically health data, is now becoming a legal issue. And organizations will eventually have a legal imperative to make sure that there are guardrails in place to prevent breaches in data. And good governance in this regard goes beyond the organization's usual siloed approaches, because proper cybersecurity requires awareness and responsiveness that permeates the entire organization. So cybersecurity, therefore, must really be integrated into the culture of the organization and embedded in training, continuously assessed and discussed openly. And the best way to prevent your organization from becoming a victim of these attacks is to think like the attacker and not the victim. So understanding what red flags to look out for is particularly important. Understanding the attacker's motives and intentions, looking out for patterns in traditional email phishing attacks, for instance, is one way you could do that. And usually these attacks are linked to some monetary or legal angle with the intention to make the user, or to make the receiver of these emails prone to fear. And so keeping an eye out for these red flags in an organization is imperative. And in order to do that, the second point I want to make is that an organization must become proficient and must commit to regular employee training. And under HIPAA privacy rule, which covers a vast majority of data concerns and data privacy concerns, it makes it very clear that organizations are to implement security awareness training for all members of the workforce. And in fact, a survey done on behalf of KnowBe4 from the Osterman Research Institute, I believe, found that employees who get this training at least twice a year have exponentially increased their knowledge around cyber threats, underscoring the importance of investing in thorough and frequent cybersecurity training. Most phishing awareness programs, for instance, are as simple as involving sending fake phishing emails to employees to figure out and to determine which employees click and don't click the links in order to determine the gaps that exist within your organization, as well as to keep your employees educated and up to date with potential threats. And I think the most important takeaway message from most of the literature is that a strong phishing awareness program can save organizations millions of dollars and rands, in our case, in the long term. All right. And I think that for South African healthcare organizations, we need to look at doing this more regularly, not just the once or twice a year. Okay, the other thing organizations can do is invest in technical guardrails. And I'm not going to go into too many details here, but basically, organizations can put measures in place to prevent the email from ever reaching the employee. And that's by having mail authentication technology in place, investing in robust email security solutions to defend against spam, malware attacks, phishing attacks. And many organizations already use this, such as Mimecast and Cisco. I think investing in various levels of technical guardrails is where we are now headed towards because of the rapid expanding network of ChatGPT and AI solutions. Other technical guardrails could be mechanisms to protect data. So having robust access control mechanisms in place and a combination of modern encryption techniques and authorization techniques to access data. I think that would be very important. Cryptography such as the SSEs or the symmetric searchable encryption and attribute-based encryption models could be very useful for that. Also, a set of emerging approaches for processing data known as privacy-preserving distributed data mining is very important for organizations to consider using when it comes to health data. So this method will basically just pull out the statistics generated from a combination of data or a group of data sources and doesn't reveal the raw data or the sensitive information linked to that data. And then lastly, another mechanism to protect data would be to invest in the identification protocols like tokenization, for instance, right? Organizations need to also keep up to date with news and information around possible threats in this evolving landscape. Joining organizations' newsletters and mailing lists, such as the ones supplied from, I think it's the Health Information Sharing and Analytics Center in the US. They're a really good resource for keeping people up to date on potential threats coming through. And then closer to home, South Africa has the Cybersecurity Institute, or the CSI, which leads a very unique risk-based approach to cyber resilience and provides intense training for employees. And what's really good about this organization is that it helps healthcare organizations or any data organization maintain and implement and regulate their processes that are compliant to ISO 27001 certification, the POPI, GDPR, and as well as HIPAA. So in essence, there are these organizations that do exist, and no organization needs to start from scratch. You can make use of the various resources available. And in fact, just engaging with these organizations, they provide you with a list of criteria, a checklist, in fact, that organizations can work through to measure their relative risks of data breaches. Okay. Another great strategy that many organizations in healthcare are using is to invest in a specific champion or steering committee that is tasked with championing and embedding IT security within the organization. And that is having weekly meetings with the entire organization or with groups of the organization, making sure that there are open lines for which data breaches or concerns around data breaches can be reported and rectified timelessly, as well as tracking the way in which the organization responds to these breaches. That becomes really important when developing frameworks for preventing future data breaches as well. And more importantly, I mean, we can also bring in the importance of cyber security insurance, developing a framework around regular user awareness training and testing of disaster and recovery plans. But I think fundamental is also ensuring that there is collaboration between the developers, the end users, policy makers, and the governments that are involved in maintaining patient privacy. So I think platforms like this that Broadreach has very successfully set up for us, where we can discuss the concerns around privacy and health data, is fundamental to moving forward for any organization. But let's get back to generative AI, and I know John asked specifically about that. Other than these general cybersecurity data breaches that we've been discussing, generative AI poses specific challenges to health data. Specifically, that it can potentially create realistic yet fake data. And we've heard the term AI hallucinations before, but this is a very real and not a hallucinated problem. So organizations need to put in place mechanisms which use advanced authentication methods, encryption technique, enhancing encryption techniques, and leveraging other algorithms like AI specific algorithms, blockchain, and digital signatures to be able to sift through information and to look for anomalies within information generated from this sort of AI, to ensure that the information presented is in fact true. And establishing a baseline for authentic data is the first step. Monitoring and evaluating data generated by generative AI systems is the second step. And then constantly doing data validation checks would be very important as well. And then in terms of cross-border health data transfer concerns, this is very complex because of the differing legal frameworks and data privacy frameworks between countries and regions. And one of the recent solutions that we found in Southeast Asia is looking at regional cross-border regulations, where countries are coming together. So we've got Singapore, Thailand, Japan. These are relatively developed countries, and they've partnered with countries such as Vietnam, Laos, Cambodia to engage around cross-border health data, specifically transfer, so that countries don't put up these security posts in place that prevent them from actually engaging with the full benefit of the software or with the AI system, because they are too worried about the real threat of their data going across borders and being sold basically, or used for nefarious ways. And that comes at the risk of really you're missing out on the potential of these software and the systems in place. So regional policies around how we are going to share that data, clear guidelines as to what that data will be used for, how it will be disposed of or stored, all these things are now becoming part of regional cross-border health data transfer policies. So in summation, organizations have a lot to do, but it all starts somewhere. You're not starting from scratch. Successfully preventing cybersecurity attacks, though, requires the entire workforce to be well educated about the indicators and risks of these very real attacks, and implementing technical safeguards, conducting regular employee training, and following the latest cybersecurity guidelines, which are there, can really save organizations from becoming victims. And so finally, in closing, organizations require awareness and responsiveness, and not just from isolated units within the organization, but it must become integrated into the culture of the organization. In fact, many authors and many policymakers have now recommended that the cybersecurity awareness culture becomes a state-mandated baseline for all public sector organizations. And I'm
Thank
very
you.
happy to provide resources and some of the guidelines and tools that I've discussed at the end of the webinar. So
Thank you,
thank you
Vedantha.
very much, John.
I know it's a complex topic. I think you did a masterful job in sort of giving us sort of the overall lay of the land. So before we get to our third speaker, we're going to do one more poll, and you'll see this on your screen. And the poll is, the question is, what kind of initiatives have you deployed to ensure safety and protection of health data? So please take the next 20 seconds or so to provide an answer. Great. Okay, so we've got the results hot off the press. So 50% say that security awareness and training programs is sort of the main thing that they've been focused on. Employee training at 29%, and then implementing baseline standards at 21%. And this is a great segue to our last speaker, who'll give his opening remarks, Steve, from the Global Fund. And in particular, Steve, I think just piggybacking off that poll, would love to learn more from your perspective as one of the world's largest healthcare donors. How do you think about this? What are the types of initiatives you have put in place at the Global Fund to ensure that countries, implementing organizations, anybody doing work with the Global Fund have a minimum set of baseline standards?
Great. So thank you, John. And it's a pleasure to be here and great to speak. And it's great to meet everyone. Yeah, so I'm CISO at the Global Fund. My name's Steve Ramsden. I'm originally from Australia. I've been 9 years at the fund. I'm working across 120 different countries in cybersecurity. And really, for me, it's about looking at the full ecosystem, really the supply chain, for example, because the Global Fund itself relies on lots of third parties and fourth parties and fifth parties, and it goes on and on like that. So for me, it's really understanding what is your ecosystem and who do you rely on, and what is important, what's critical. So really, for me, it's really understanding what's critical to the business, and if there is an incident or an attack, how are you going to recover from that? Because it's not if you're going to be attacked, it's when. So for me, it's all about resilience, right? And then this can also be resilience from like whether it's COVID or pandemic response, cybersecurity attacks, even weather and climate change. We all have to become resilient. So for me, a big focus of mine is around cyber resilience in the digital age. So for me, what I've been doing, particularly in conjunction with my colleagues in Global Fund, is looking at the supply chain and our partners, whether these are principal recipients, ministries of health. And what we've been trying to do, especially in my team, is train the supply chains and train also the principal recipients and help support their training programs they already have. What I've found to be particularly effective is what was mentioned just before by Ruwan and Vedantha, is training programs. But really now, going in the mind of an attacker and how they attack you, just simply doing a compliance 10-minute or 15-minute training program and tick the box, that's not effective. We have to really change the game. So what I've been doing is doing this really more attacker-focused training so that people really understand how attackers think. And they're also attacking you where on your social platforms like LinkedIn, Facebook, and other, even WhatsApp, people are trying to attack you. So for us, really, it's about looking at all these attack vectors and really training the staff and the suppliers and everybody to be more aware. What's really, I mean, with the age of AI too, AI will bring great good to social impact, which is wonderful, but also in the wrong hand, it can be used to attack people, using very sophisticated phishing emails. So this is another reason why we all of us together have to be very aware. Whatever we do in the digital world, we have to be really, really careful and mindful. So for me, the cyber behaviors has been a big thing. Also, another thing is standards. There are a lot of standards out there in the world today, and it can be very confusing for all of us, especially for those people that are not focusing. So what I've been doing at Global Fund is trying to boil down all the best industry standards, whether this is ISO or other ones, and make simple, easy to understand guidelines for people just to follow. So it's like checklists, and we call this security by design and privacy by design. So I've been working with the World Health Organization in conjunction with the Global Fund, and we're now looking at creating some very simple guidelines for the community. Okay. Also, the other area for me is understanding where your data is. Not everyone understands where the data is, so mapping all the data, where the data is, especially your confidential data, and also getting in penetration testers, and these are ethical hackers. These are the good guys, the good people, and testing your defenses. Like, can they break in? Where have we got weaknesses? Because for me, the world is always changing. Every day there's changes happening, or there's new threats, new ransomware attacks, and we also always have to be checking and hardening our systems. So for me, I employ internal ethical testers, and they're really, really great because they help secure the ecosystem for me. Rather than an attacker gets in, we try ourselves to keep very, very strong. So for me as well, cyber hygiene is super important. Now, what I mean by that is making sure you don't share passwords with people, and don't use simple, easy to guess passwords like 1, 2, 3, 4, 5, 6 or whatever. Don't write passwords down on bits of paper and stick them on your laptop or on your desk. I mean, this sounds basic, but people are doing this, and that's what the problem is. So we really have to look at how we do better cyber hygiene together. So in the guidelines would be ideas on cyber hygiene. The other thing as well is bringing in a whole of government approach, right? So we have to collectively together come together and beat this, because I think the government, the ministries of health, academia, private sector, we have to come together, and we have to have a single message to everybody. And this is something that I've been promoting here in Switzerland, as well as collaborating too with the countries, you know, in Africa, in Asia, and Latin America, is how do we come together, both private and public partnerships around cybersecurity. So I think this is really, really important too, and this is something that I like to push. And then finally, I think another thing is ransomware. I'd like to mention ransomware is a really worrying thing for healthcare and hospitals. And also, so to mitigate this, we should always have offline backups. Always make sure we have backups of all the data held offline separately, because we don't want to be paying ransoms to people. So especially healthcare and hospitals, unfortunately, are targeted. And this is the problem. So we really, really together have to come together as a community, as a network, and we're stronger together. So that was a very quick update on what I'm doing, John. Thank you.
Thanks so much, Steve. And I know you were just glossing over, because in our preparation conversations, there's a lot of other things that you're doing.
Yeah.
So maybe I think we're going to move now into the formal Q&A portion of today's webinar. We've got lots of questions rolling in, so I'd love to spend probably the next 15 minutes or so before we do a wrap up on those. And I think that the first question comes from Justice in Nigeria. And I think, Steve, this actually might be great for you, given your role at the Global Fund. So I'm just reading off another screen. He says, in a fragmented healthcare system, interoperability is a significant challenge. How can a country, e.g. Nigeria, address this issue to ensure seamless and secure data sharing across different healthcare providers and regions while upholding privacy and ethics standards?
Well, it's a great question.
Yeah.
And it's one of the biggest challenges that we all have. So it's a very relevant question. I think what we can do is learn from potentially other countries where we have good practices and bring that in quickly. So what we should do is really look out there across your network and the network that we have, and say where our best practice is being used, and taking that into your working daily working and approaches. You know, rather than trying to reinvent the wheel all the time, it's already been solved in certain countries. So what we need to do then is collaborate more and share knowledge together in a group. I mean, there are open standards like FHIR. The FHIR health standard is something that I get behind. I think every product should have open standards built into it, right? Otherwise, don't take it. So whenever we select a product, it should be having open standards so that we're stopping the rot of siloed systems that do not communicate. So I think a fundamental selection criteria of any health product should be, has it got open standards for integration, and has it got security by design? Otherwise, don't use it, because for healthcare, we have to have the best, and we have to be able to share data securely and have privacy by design. So I hope that helps.
No, that helps. Just one follow-up question, Steve. Are you seeing that FHIR is also? I know in the U.S. it's being required, but in the countries we work in global health, is FHIR, do you think, is going to be adopted, or are there other standards that you would recommend?
I think I might pass to Ruan.
Okay.
Ruan, if you don't mind. I think this is something that I think would be very close to you. Yes, over.
Thanks, Steve. Yeah, good question, John. I think it's not widely used, but there's not an alternative coming up either. You know, so I think what we are seeing is the push from various players in the industry to move towards FHIR. I think Steve made this comment earlier. We want to build on the work that's already been done, and there's little value in reinventing a standard that already does a good job of secure data exchange. So I think we'll keep pushing for it in the projects that we work on, and it'll be interesting to see if it gains traction. And then maybe one or two things that I'll add to Steve's perspective here. The one is around, the data exchange. We so often see that there are many hurdles in place to get access to data in the healthcare system. But then as soon as you clear those hurdles, you get access to everything. So it's almost a binary discussion about no access or all access. And, we believe there's a place in the middle where you just get access to what you need in order for the task to be fulfilled. So if you want to improve the performance of a clinic, you don't really need to see the individual patient records. You need to understand how many visits, time of day, and so forth, but you don't need the identity number of the person that was, visiting the clinic. And so looking at each use case and doing a bit more diligence in terms of selecting the right level of data share to happen, I think is important. And then one last thing closely tied to that, when we do need to share patient records, there are ways to do so through de-identification, where you can share a record to another party. Vedanta also mentioned this, as a privacy preserving technology, something like tokenization or de-identification. Those could be useful techniques to further limit the risk. So if an attacker gets access to the system and it only contains tokens, those tokens are useless as opposed to having the full health record available in that system.
Thanks, Ron. Actually, another question for you, Ron. One of the webinar viewers asked, what are offline data backup options, and what are the comparative benefits and disadvantages of online versus offline data backup?
Yeah, so offline, in let's call it a decade ago, when we still had much of our systems in our own data centers, offline meant typically writing it to hard disk or a tape and then putting it in a vehicle and taking it to the other side of the mountain. That's kind of what was meant by offline. Increasingly, we are moving data to the cloud. And inside the Microsoft cloud, for example, you could have an offsite backup where your data in Ireland is backed up to a Microsoft facility in the UK. And by definition, that could be an offsite backup. We like to think of an extra layer of also vendor independence. So if you have all your data in Microsoft, it may not be a bad idea to also store a copy of at least portions of the very critical data in another cloud provider or in your own data center, just so that you do not have single dependence on a vendor. cloud outages happen, and we've seen them across all the vendors. So no one vendor is better than the other. They will claim that they are, but ultimately there will be an outage somewhere, and you don't want to be dependent on just a single entity in order to get access to your data. So in a cloud first world today, offline can just mean take it to another online place where you can access it if an online provider becomes unavailable.
Got it. Okay, thank you. Another question that came through, and Vedantha, you started you touched on this during your introduction, and if there's anything else you want to expand on, please do so. But the question is, what technological advancements or practices can help enhance the privacy and security of health data? And then I think after Vedantha, maybe Steve or Ruan, if you also want to chime in. I know we've touched on bits and pieces of it in the various discussions we've had.
Okay, that's a very good question. And so if you could just repeat the first bit of it, John.
Yeah, so what technological advancements or practices can help enhance the privacy and security of health data?
Got it. So I wanted to check. So it's two things. It's the technological advancements and it's practices. Absolutely. Whoever asked the question clearly picked up some fundamental structure around what it takes to prevent against these breaches in health data. So I think some of the technology in place is there are algorithms in place, for instance, that are able to identify threats before they happen in certain aspects. There are also tools, blockchain tools that can be used not for so much for the attacks, but to verify information from artificial intelligence systems, specifically generative AI. I think those are very important, two sets of very important tools that we can look at using. And in terms of practices, well, there's a whole lot. That's definitely Steve, Stephen's work centers around that. But it is everything from it would take your workday practices to be reevaluated in some aspects. We have to shift from being so open to clicking on emails from our bosses to make sure we respond on time, for instance. So it changes the attitude that you have towards everyday work practices. And they call that sort of the performativity of technology, where the technology itself shapes your everyday work practices. And I'll say it'll take everyone needs to change their practices towards it to make a success. But I'll leave my other very capable panelists to chime in as well.
Well, I can add a couple of things then. I think Vedantha also touched on some of this in her initial piece. So for me, AI for security is an interesting angle. I mean, we often think of AI now in the context of ChatGPT and generating images, but artificial intelligence can also pick up patterns and anomalies in data. So for example, if all of a sudden there's a large amount of activity from an email inbox, that could be detected by a machine instead of a human having to monitor that, and you could detect that someone has breached your network, as an example. So that's an interesting angle to me. We touched a little bit on cloud computing. I think the adjective I'll add there is secure cloud computing, because it is possible to do cloud computing incorrectly, and a lot of we hear about data breaches, which is actually just cloud systems configured poorly. Data buckets in AWS without a password, so it's not really anything was breached. The data was just put on the internet for everyone to see. But when cloud computing is done right, I do believe the building blocks that all the big cloud players have is a lot more stringent than any single organization can build on their own. So you build on a very solid foundation. And then the last thing, and even as a technologist, this goes above my head a little bit in terms of understanding how this works, but there's an emerging field of privacy enhancing technologies. So something like homomorphic encryption. What that essentially means is it can do operations on data without actually looking at the data, which is a little bit mind-boggling. So if you think about it, if you have two boxes, in the one you've got 5, and the other one you've got 10, you can tell the algorithm add these two numbers without actually disclosing the numbers, and it'll just give you the answer. So again, that could be very useful to keep, for example, the health record locked in the box, but being able to transact on that health record, running queries or getting data from it without actually having to see the raw data that's underneath.
Thanks, Ron. And I think we probably have time for one more question. So this comes from one of our viewers. How do you monitor workforce activities to safeguard cyber risk in terms of their internet access and surfing? So maybe Ruan or Steve, if you've got thoughts or experience on this.
Yeah, maybe I can start here. It's a really great question. So we have monitoring tools in place, for example, that monitor sort of anonymously, by the way. This is all done anonymously at a very low network level. It's called the DNS level. And what we do is we see if anybody's accidentally going to a site that could be potentially malicious, as in bad, it would block these sites. So actually what we do is we have a big filter. So if somebody accidentally went to a website they were unaware of that had, you know, malware on it, or it's a dangerous site, we would block it. If it's really for a real business reason, they need to go there. And sometimes there are sites categorized incorrectly. What we do is we get a business approval and say, yeah, you're okay to go. Then also we have endpoint solutions such as Microsoft Defender. We're a big Microsoft user at Global Fund. Microsoft Defender has intelligences built in to protect as well. So and as Juan correctly said, if we move to the cloud, they do it better than we can do ourselves internally. So Microsoft has lots of different layers, and we call this defense in depth, like an onion, so that we have lots of different layers at the network level, at the application level, you know. And so really we do this through defense in depth and leveraging partners such as Microsoft and another company called Cisco, which is our networks. So we use this and we have this defense in depth. So I hope that answers.
Great. Thank you so much. I'm sorry.
I think those are all good technologies. The one thing I'll add to that, and it's almost around the softer side of the problem, is to get your users to be part of the security team and not make them the students in the class. That analogy makes sense, you know. So security shouldn't be this punitive thing where if someone clicks on a bad link, then they fear retribution. You want to have a culture where people are willing to report if they made a mistake, if they see anything funny that they report that. And so having a tool, for example, that scan, you know, which websites they access. It's not about monitoring the staff member and to discipline them if they click the wrong link. It's just to give them the tools to identify that something is wrong and that potentially, you know, their own data is also at risk. And we've certainly seen, I was glad to hear Steve talk about the security awareness and training. We've seen in our own internal programs doing that, where people went from being ashamed of clicking a link to now actually trying to not click the link, first of all. And then if they do click something, they report it to say, hey, you know, I want to put my hand up quickly and say, I may have made a mistake. Please check out and make sure that we're still good here. And that culture shift from security is the IT team's problem to security is actually everyone's problem. Everyone in the organization is part of the security chain, and we're only as strong as the weakest link. That's made a massive difference in our own experience driving those programs.
Thanks, Ron. We're coming to the end of our webinar. We have roughly 5 minutes left. There are quite a few questions, but as I mentioned, we will send a recording of this webinar in a couple days. We will send resources and we'll try to address some of those questions with the different resources. But I think just one thing for you, Steve, before we close, is that the original question from Justice in Nigeria, he wrote back and said he really appreciates your answer and would appreciate any best practices on interoperability. So maybe after this webinar, if you could just let the team know if there's a couple of links that you can put in there, and we'll make sure that those best practices are available.
Sure, it'll be my pleasure. And also I can share details of the cyber behaviors we've been doing, which has been great. And as I mentioned, we're going to be training some other African ministries of health using this approach too. So yeah, I'll share these details.
That's great.
Be my great pleasure.
Thank you so much. And I think just really in the final sort of 3 minutes or so, I'd love each of our panelists to give a 60-second sort of parting shot, 90 seconds max, if there's really something else you want to add to it. So we'll go in the same order. So Ruwan, Vedanta, and then Steve.
Yeah, thanks, John. I think my parting message is I hope that this webinar encourage people and energize people to take action. And even if it's small incremental action, that's a lot better than doing nothing. So the message from today is not to overwhelm you and paint a very black picture of the future, but it's to create awareness and create urgency to start doing something. And the security journey is the old analogy of being a marathon and not a sprint. You're not going to implement the program in 12 months and then check the box and you're done. So start on the journey, keep going at it. Remember, security is everyone's job. And looking at some of the resources that we'll send out, they will be very practical. It's down to the checklist that Steve mentioned that you could either fill out yourself or ask the IT team to do. And then there will be 50 things that you need to work on. And then pick the top 5 and start working on them. And next month you pick the next 5. And before you know it, you would have come halfway down the list and make rapid improvement. So let's start today and let's keep improving on this journey.
Thanks, Ruwan. Vedanta?
Thanks, John. Very well articulated, Ruwan. For me, I'll probably echo the same things that Ruwan said. The first thing would be that as much as privacy and patient privacy and confidentiality is important, making sure we still maximize the benefits of AI and use of data across various platforms we shouldn't minimize that. So I think the only way we can do that is if we actively engage with these uncomfortable questions. So for instance, with cross-border data sharing, it would be a quote unquote lazy approach just to have a blanket no data across borders policy. There needs to be active engagement on each component that makes up your framework around cybersecurity. That's the first thing. The second thing is echoing what Ruwan said, in that cybersecurity needs to be embedded in the culture of your organization. Every single individual within your organization has a role to play in not only identifying threats, but maintaining a culture of security and awareness. That's fundamental for the success of these type of things. And the last thing would be to not overwhelm yourself. Like Ruwan said, prioritize the first 5 or 3 things that are important and work from there. And that you don't have to start from scratch. There are existing frameworks, there are existing regulations that you can piggyback off. And that's it from me. Thank you.
Thank you. And then finally, Steve.
Well, don't know what to say on top of everything. I would just say it's never been a more exciting time to be in cybersecurity. With AI, with digital technology and the pace of change, it's just exciting. Every day has something different to bring. It's a great career to be in, and it's also it's such a societal impact to society. So what we're doing here really is protecting the livelihood, the healthcare data of everybody in the community. I would say as well is try and tap into networks and other people, find out what they're doing, be curious, and leverage a network within your environment, because we're stronger in numbers. No one has all the answers. But it's together as a community, we're stronger. So I would say, if you want to find more, reach out, look at our links we'll give you, but try to come together as a network.
Well said. And I think just, in closing, Steve, I really echo everyone's comments, but in particular yours, because I do, we don't all have the answers. And I think we all in the global health community have a great responsibility in the work we're doing and the patients we're serving. And so I think the more we can come together, share best practices, work together, the better off we are. Because, as Ruwan pointed out, healthcare is the most attacked industry. And I didn't realize that before this webinar. And number 2, it's here to stay. It's not as if we, October Cybersecurity Month, we sort of check off our SOP. We said, hey, we did the training. It's done. We'll do it next year. It is literally our posture every single day. because it's going to be with us. So I want to thank you all so much for speaking and providing your knowledge, and just thank everybody for spending your hour with us. We look forward to staying in touch. We'll send out some follow-up emails with some resources, information, and look forward to building a community together so we can address this issue.